Good morning, dear students. Today's our class mainly based on the drugs used for this treatment of constipation. Laxatives categories of drugs are usually used for this treatment of constipation. Okay, today's our class learning objectives are first you discussed about the drugs is used as laxatives and what are their mechanism of actions, uses and adverse effects. Next we come to this the clinical applications of laxatives and what's the misuse, abuse or dependency of laxative use, and then what are the consequences of prolonged use of laxatives, then what are the role of prokinetic drugs in the treatment of constipations. Usually these prokinetics categories of drugs are used for this treatment of vomiting is an antiemetics category. So what's the role in the treatment of constipation? Then we summarize our class with FDC banned combinations in India. So we discuss one by one. Okay, before going our class, we just discuss one case based on this constipation. A 50-year-old man complained to her physician that the drug she was taking did not work and that she was still suffering from constipation. The woman had a long history and took several drugs in the past with limited success. She was presently taking lactulose. The physician decided to try another drug. Then which of the following drug was most likely prescribed? Here four options are given: ondansetron, dronabinol, lubiprostone and resicotrotol. Which one is preferred? In this case, this 50-year-old woman is tried lots of laxatives category and currently she was presently taking lactulose, but still she is suffering from constipation. So in these situations, which one is the most preferred drug? Okay, this ondansetron, this drug is a 5-HT3 receptor antagonist. Is a good antiemetics. This mainly used in vomiting. This associated with chemotherapy induced vomiting and radiotherapy induced category. So it's a good antiemetic. Then dronabinol is an cannabinoid category drug. Is a good adjuvant drug in antiemetics. Lubiprostone, this drug is a prostanoid derivative and this mainly open the chloride ion channels in small intestine and these are effective in treatment of constipations. This drug is FDC approved these drugs in 2006 and this 2008 is successfully used as this constipations with IBS and idiopathic chronic constipations, but the safety profile is limited. Now its safety profile, this research reached up to this guinea pig experiments. Now we need more studies on humans to reach the good safety profile. Like now we are unknown about the usage below 18 years old and pregnant woman, special categories like this cardiac liver failure cases. So precautions are needed. Their administrations. This the only strict prescribed drugs for laxatives. In these situations, all these laxatives are failed, so physician decide to prescribe this lubiprostone. Okay, this resicotrotol is an antidiarrheal drug, is a good prodrugs category and is usually decrease the intestinal secretion, so is effective in treatment of diarrhea. This lubiprostone is prostanoid derivative. This acting on the chloride ion channels in small intestine. This increase the intestinal secretions, is effective in the treatment of constipation. Okay, now come to this constipation. What is constipation? Is an infrequent and unsatisfactory defecation fewer than 3 times per week. That is passing hard stools or straining incomplete and painful defecation. These are some risk factors for constipations: female gender, over 65 years of age, low caloric intake, that is eating less food, greater number of medications used. Some of these medications usage precipitates constipation. Sedentary lifestyle is the lack of exercise, ignoring the urge to defecate, These are the main risk factors for constipation. Okay, these are the important signs and symptoms of constipation: infrequent defecations, nausea, vomiting, anorexia, feeling full quickly, stools that are small, hard, difficult to evacuate, rectal bleeding, weight loss, especially in chronic constipations. Okay, so what are the preventive phase for these constipations? These are the some non-pharmacological measures. That is, we can increase the intake of high fiber diet and minimum fluid consumptions 1500 ml daily, and then include our diets this vegetables, fruits. So this is helpful for this prevention of constipation. Okay, now let's come to the drug groups is effective for this treatment of constipation. Laxatives. These are the drugs groups which promote the evacuation of bowels from colon. Catalytic purgative evacuants. This catalytic action, that is the evacuation of unformed stools from the entire colon. Best example is castor oil. This is effective for the evacuation of unformed stools from entire colon. Catalytic actions produce laxative action in lower doses, and at higher doses produce catalytic action. These are the different classes of laxatives. Bulk forming agents, this effective in the mild cases. If this non-pharmacological measures are failed, first we tried with this bulk forming agents: isophagal, methyl cellulose, ampicillin. These are available as the over-the-counter preparation. Osmotic laxatives, this categories mainly includes magnesium salts and sodium salts. The lactulose and glycerol suppositories. This lactulose and glycerol suppositories are most commonly used. Stool softener categories. These categories are helpful if the stools are dry and hard. In that situation, we can try this stool softener. This is a liquid paraffin and doxycycline sodium. This category is stimulant laxatives. These categories are helpful if the stools are hard, difficult, and these are also tried before surgery. This bisocordial, senna, phenolphthalein, dandrone, sodium picosulfate, castor oil, tecasterol. From this category, this bisocordial and castor oils are mostly used. Next, we classified based on the onset of action of drugs and types of stools. Some of these drugs shows the onset of action in 1 to 3 hours and is effective in watery evacuation, mostly in this osmotic laxatives like this saline laxatives, for examples like magnesium salts and this sodium phosphates, polyethylene glycol. Stimulant laxatives like castor oil, and some of these drugs or agents having onset of action 6 to 8 hours and is useful in semi-fluid stools. Stimulant laxatives categories like diphenyl methane derivatives like bisocordial, phenolphthalein, sodium picosulfates, anthraquinone derivatives like senna, casca, sagrat. Some of these agents showing the onset of action is 1 to 3 days, the slower onset of actions. Mostly this bulk forming laxatives, bran, dietary fiber, physalim preparations, methyl cellulose. The surfactant laxatives as a stool wettening agents and emollients. Mostly this doxycycline sodium, and mineral oils like this liquid paraffin, lactulose. These are showing the slower onset of action in 1 to 3 days. Okay, this detail of these drugs, therapeutic uses, adverse reactions, indications already discussed in our next video. Okay, thank you.